Hello everyone, welcome back to the channel again. So today we have a very simple yet very important case on echocardiography that we should not usually miss. So this is a case of infective endocarditis who presented to us with history of fever and all. Luckily this is my workshop going on here in Vadodara, Gujarat, and I have all my students with me who is attending this video lecture also, which I'll be putting in my YouTube channel. These are very bright students who have came all across India from Maharashtra, Madhya Pradesh, South India, etc. And I'm glad that they have accompanied me. So without wasting time, let us directly jump to the echo features. Although it's a very small vegetation, but I'll try to make it clear to you all. So we have this patient who presented to us with history of fever. This is called as the plaques view. This is the mitral leaflet, anterior mitral leaflet. This is the posterior. If you pay attention to the cursor, this valve is showing a small echogenic structure which is very difficult to diagnose, but if you pay and see them very closely, there is a small mass which is moving with this mitral leaflet to and fro and towards this atrial side. This is a left atrium. So this gives a very big hint that this could be a case of mitral vegetation, which is called as infective endocarditis, with the feature that is present, that is mitral regurgitation. We know vegetations would clearly be associated with mitral regurgitation, with aortic regurgitation. So this patient have all the features, be it clinical feature or echocardic feature. Now this picture is very clear that one infective endocarditis vegetation is there at the posterior mitral leaflet and one is there at the anterior mitral leaflet. If we try to change the orientation of the images, this is again your mitral leaflet and you can see one mass coming and going from the left, from the posterior mitral leaflet inside the mitral valve surface area. So this is the mass which is attached. If I again change the orientation and come to the 4-chamber view, again you can see one echogenic freely mobile mass like structure which is attached more to the posterior mitral leaflet than the anterior. So this is clearly a case of infective endocarditis which has presented to us with all the features of clinical fever, etc., and a mitral regurgitation. Ideally, we should now send his blood culture, go to the clinical examination, try to see the Janeways, nodules, oscillars, nodes, and whatnot, whatever we can get on clinical grounds, and manage the patients accordingly. So this was a short video just to show you that this patient had mitral vegetations. This is his aortic valve which is looking free. Let me come again to the aortic valve level. This is the aortic valve with all the three cusps which is looking clean. This is pulmonary valve and this was the tricuspid valve. So when you get infective endocarditis on one valve, you should always go back and see all the other valves. So rest of the valve are clear except for the mitral valve which is showing a small vegetation. So I hope this is a short video yet a very enlightening video, and the next time any patient of infective endocarditis comes to you, it doesn't go undiagnosed. Thank you so much for your patient learning. Thank you.